Welcome to the Beyond Physio podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community. Welcome to the Beyond Physio podcast. Today, our guest is Dr. Marianna Shimelfarb. And Dr. Marianna, I don't want to take away the limelight from you. So can you tell us about your background training and how you got into or interested in integrative medicine and where that brought you today?
Yes, hello. Thank you for having me today.
You're welcome.
Sure, I can tell you a couple of words about myself. I am a family physician and I have trained in integrative medicine. So after completing my residency training in family and social medicine, I did a fellowship in academic integrative medicine. I practice in the setting of primary care. I see all ages from infants all the way to 100 years old, which was my patient yesterday.
Really?
Yes.
Centurion.
So I do pediatric adult medicine and geriatrics. I also do gynecology, including procedures such as IUD insertions, contraception management, and menopause management, and then the whole array of primary care services and angles with an integrative approach.
That's great. So then your interest in integrative medicine, Dr. Marianna, that started from before medical school, right? Can you talk more about that?
Yeah, sure. As a matter of fact, my father is a physician. He's retired at this time. He was a psychiatrist. My grandmother was a pediatrician.
Oh my goodness.
So
lineage.
Yes, very lucky. So we had, along with conventional pharmacies in Soviet Union, there were herbal pharmacies and homeopathic pharmacies.
They had it back even then.
Yes.
Wow.
Yeah. So that was not exactly mainstream, but it was accepted. There was a very strong school of physical therapy. And I remember as a child, actually, there was some subtle nuances with my shoulders and arm length. And so my mother was taking me to a pediatrician's office where I had regular PT sessions.
Really?
Yes.
Oh, wow.
Yeah, to correct that.
Interesting.
Actually, as a matter of fact, I think they start PT from infancy in certain instances. Yeah.
That's so cool.
Yeah. So growing up, my parents had this approach of healthy eating, less medicine, more natural, preventative things. And at a certain point, they became vegetarian, and we took valerian root I took valerian root for my music school exams.
Oh, man. Can you tell us what valerian root does?
Valerian root is a calming herb.
Yes.
Yes. So it has a very bitter taste. I remember it.
It's funny because in my culture, I remember vividly, my parents would boil these antlers from deer. I mean, this is like the old school, old country from Korea. And our house would reek of this stuff for weeks at a time. It didn't taste good either. We'd have to chase it with orange juice. But I can't say I was any healthier, but there's a very cultural dynamic towards using herbals and whatnot. And even in Eastern cultures, that sounds very similar to what you were going through as well.
Yeah, exactly. And our parents used cupping on us for better or worse, and actually was using flame and glass. With glass, it was mortifying because your parent was just sitting there with a flame and they were about to put it on your back. And that happened whenever you had a cold, a sneeze, a cough. We also used mustard plasters.
Really?
Yeah, on your back for cough.
Yeah.
Everybody used it. And also a mustard powder bath for your legs if you had a cough or a cold.
Really? Was it effective?
Yes.
And is it evidence-based? Is there like studies on this or anything? Or
I'm not so sure, but
it definitely worked.
we can start a trial.
Yes.
Yeah.
That's awesome.
So when my sister had recurrent ear infections and when she was younger, she was a toddler, my parents decided that they were not going to give her any more antibiotics. Instead, they started to take her outside in the snow and pour some cold water over her, which mortified our neighbors. We lived in these big apartment buildings, but the ear infection stopped. No, this whole culture of cold and hot showers.
Yes.
Yeah.
You already lived it out.
Yeah.
Basically, your whole family was ahead of its time.
Yeah.
In the medical space, which is great.
Fair enough. Yeah. Yeah. This started happening since I was a kid. And I would say my mother and stepfather were quite pioneers in a lot of these things. When I got into medical school, I already had a concept in mind, or rather a lifestyle in mind, or a philosophy in mind. And while I was in the medical school at the University of New Mexico, I, in my first year, went to an integrative medicine conference, and Dr. Ben Kligler, who
Oh, yeah.
Years later, was
Yeah.
my fellowship
Oh
mentor.
my gosh, it's so cool.
Yeah, he was presenting at the conference in New Mexico. He came from New York City, and he was saying how he opened I think they were starting the fellowship. I think they started the Center for Health and Healing at that time. I hope I'm not mistaken. But that was around circa 2002. I got really inspired, and it gave me more specific direction. So fast forward towards the end of residency, I applied for a fellowship, and I've completed that. And that kind of formalized my interests. And since then, I've been practicing that way.
That's amazing. So if you could tell our audience more about how the integrative approach maybe differs a little bit from a standard Western approach in medicine, so that we can get an idea of what that looks like, and that sort of clients that know what to look for when they're looking for these services. Can you go over what that looks like and how you practice differently from other Western trained physicians?
Sure. I do want to say that some of the Western trained physicians may be practicing in a similar way to myself, because I think overall the way that I practice integrative medicine and some of my colleagues is more of a comprehensive approach. And to be fair to some of my colleagues, they do that and they do an amazing job. For example, I think it's best to give an example. So
Yes,
for instance,
exactly.
if somebody comes with abdominal pain, right? If they come with stomach pain and they're complaining of heartburn, the way that I would approach it, of course, I would ask what we call 7 dimensions of the disease: when it started, how long it lasted, what makes it better, what makes it worse, etc., etc. If it happened in the past, I'd ask if they have seen a gastroenterologist in the past, if they had any studies. But in addition to that, I will ask them in a detailed way what they usually have for breakfast, lunch, and dinner, how many cups of coffee they consume. I will specifically ask them how often they drink alcohol and how many, what kind. I also will ask them what they do for a living and who they live with and what kind of stress they experience, how they respond to stress, what they do for stress reduction, and about their sleep. I will ask about their medications. I will also ask if they take any herb supplements or vitamins. I will ask them if they've done anything, and depending on the person, I will also expand my question and say, well, have you, not necessarily will ask anyone, but if they say, well, I've tried everything on earth, I will say, okay, well, then seeing specialist, did you see the specialist, but also did you see an acupuncturist? Have you, depending on the complaint, right? I try to go as wide and deep as possible, depending on the situation.
Right.
And then the outcome would be is, let's just say, I assume they have GERD, right? Or reflux,
Yeah.
right? As an allopathically trained physician, I will look for red flags, and if anything will warrant their referral to a gastroenterologist.
Sure.
If they need endoscopy or colonoscopy, I will evaluate the severity of symptoms and their circumstances. If they're having something stressful happening, let's say, for example, they're an attorney, they have a case coming, they're accountant, it's the end of a tax season, and it's going to be all better in 4 weeks, but this is really horrible. I may prescribe something like omeprazole, but I will tell them it's only for a month. I don't want you to stay on it for the rest of your life.
I love that.
But I want you to feel better too. But then I also will talk to them about their diet. I may or may not refer them to a nutritionist. I'll talk to them about stress. May or may not refer them to therapists. And we also, depending on the person's comfort, we'll talk about some supplements like probiotics, the DGL, slippery elm.
Yeah.
So that's in a nutshell an example of how I would approach.
I love
disease.
that. It sounds, actually, it's funny because a lot of the questions you ask are the questions we ask as well, just to make sure that we're the right fit for the client, and also to make sure that we haven't missed any red flags ourselves, and that we don't miss an opportunity to refer the client to the right medical provider for what they're coming in with. But I love how you talked about stress and nutrition and that kind of thing, because we find that a lot of our clients with chronic pain tend to not eat well in general. Their sleep is very poor. So we're often asking about, well, do you have any sleep hygiene sort of techniques or habits that you do and rituals that you do daily to make sure that you're sleeping well and that kind of thing. But I love that you have a very comprehensive way of asking questions. It sounds like you spend a lot of time with your clients then in that meeting too.
Yes.
Yeah. That's great. So then, and from there, because you have such a wide network of people that you can refer to, you are definitely that first point of contact to make sure that that person gets to the right help if they need more than what you are going to provide.
Yeah, absolutely. I am very attentive to my referral network, very lucky to have incredible specialists and practitioners in the area. And then I like to hear back and to have the patients to follow up and know what the next steps are. And I always ask them to make sure to follow up with me if things are not improving, for sure.
Yeah, I love that. And Dr. Marianna, as far as going into fellowship for integrative medicine, what are the things that they teach differently than if you're going to fellowship in any other specialty? Is it really the approach? Do you go over a lot of supplements and that kind of thing and herbals?
My fellowship was pretty comprehensive, and again, accentuated also on being academic. So
Yes.
that was within the residency for family medicine, and also houses curriculum for integrative medicine for residents at Beth Israel. Well, now it's Mount Sinai Beth Israel
Yeah.
since then. And at that time, I spent part of my fellowship at the Center for Health and Healing.
Yeah.
And that was closed around 2015-16.
Mhm.
And so during that time, I spent some time learning about supplements, but also how to evaluate the supplements in terms of quality
Oh, that
and
sounds important.
appropriateness.
Yeah.
You learned about other modalities. Was part of my fellowship was weekly interdisciplinary conferences.
Oh, cool.
Where as a fellow, I would present a case, a couple of complicated cases. And within that, in that group, you'd have acupuncture students and acupuncturists.
Mhm.
You might have had PT student or PT who was interested in that program. That specific conference that was weekly for 9 months, there would have been an herbalist, I may have been an energy healer, a
Yeah.
psychologist. It was fantastic.
I see. So integrative, not even just in what you take into your body, but also in the other kinds of modalities outside of that you can bring into helping a client.
Right. Yeah.
That's really cool.
And I also studied Ericksonian hypnotherapy. That was
Fun.
I could choose a course, so I chose that. And
Yeah.
that
That's
was
great.
fantastic.
Now, I don't know if this is a question as far as like anything current, but are there supplement brands that you would say are better than others based on any of the research that you've done on these things?
Sure. Yeah. I mean, I have no relationship, unfortunately, with these companies
Yes.
because I would like to get some discount.
Yes, right.
Because it costs me a couple
lot.
$100 every month to get that for myself. But certainly, ever since I did the fellowship, I've learned that Nature's Way.
Nature's Way.
Yeah, Nature's Way was a quality brand, and they're very affordable.
Mhm.
Now, pay attention, not Nature's Bounty. I tell my patients that's a knockoff from CVS.
Oh, is that right? Oh,
Yeah.
interesting. Nature's
Not,
Way.
not a knockoff. There's Nature's Bounty, and there's some Nature Made. Not that. No.
No.
Nature's Way. And then I think Integrative Therapeutics,
Integrative
right?
Therapeutics. Right.
Yeah.
That's good to know.
Yeah, pure encapsulations. A couple. Yeah.
Because, with the supplement industry, it's really hard to see it's really hard to know what you're really getting.
Yeah.
Because a lot of them are not FDA approved or they haven't been tested or whatnot. I'm always wondering when clients ask me, oh, so what would you recommend? Like, I don't really know what brands physicians would recommend. It's actually glad that you answered that
Yeah.
to some degree. Cool. What are some like common myths or misconceptions about what you do as an integrative physician versus what like an allopathic or Western trained physician would do?
I think that one of the biggest misconceptions in general about integrative medicine, I'd say from client perspective, is that our expectation that the way that you would diagnose someone is by doing immense amount of testing
Mm-hmm.
and give them lots of data
Yeah.
and find something wrong in that data
I see.
and then fix that,
Mm-hmm.
which I find fascinating because this is a mirror of allopathic model.
Mm-hmm.
Because that's in allopathic medicine or Western medicine, we have this bullet approach, right? Let's aim and see if we can find the abnormality within the testing
Mhm.
and then fix that. And when someone comes in to see me and they want all this in-depth testing done, are looking for that one cause and hoping that will get fixed and it will get named and fixed. I'd say it's not what I do.
Mm-hmm.
Now, to be fair, there is a whole field of functional medicine, which some of my dear friends and esteemed colleagues practice,
Yes.
and they do use different type of testing that is more that is different from Western medicine. You could say more thorough,
Sure.
and they approach it with their deep knowledge and analyze it, and they're able to comprehensively then use that knowledge and data in diagnosing someone and treating someone. So that does exist. It's not something that I do, but again, I'm not against the functional medicine model. More rather looking for that bad unicorn,
Yeah, that's right.
the rotten one.
Yeah.
Yeah.
That's funny. I think from my experience working with clients, they've been to other providers and everything. And for them, there's almost like some false sense of assurance that if I just understand what this thing is, I can get it fixed, it feeds into what you just said, where they think it's just one thing, where really it's a whole like slew of things, where it could be like your lifestyle, like you said, lifestyle, it could be your sleep, it could be your stress, it could be how you're exercising or not exercising that's contributing to the pain that you're having. And maybe all those factors together become the root cause of why this person is in pain. And the same way where like people, I think, looking for that one answer or physician going that same approach, it might, for some people, feel like, oh, well, if I just do that, then this is going to solve my issue too.
Yeah. I'm a big believer in mindfulness and mind over matter, and it's the hardest way to practice to believe that you can actually tap onto that mindset that exists in your client or your patient.
Yeah.
But once you're able to do that, when you have, and I'm sure you've experienced that, when you have that connection in the mindset and you're able to eliminate that existing belief in your client or your patient that they actually can heal through a certain path, that's just a bingo, right? It's the most gratifying.
Absolutely.
Yeah.
I would say that's the first session, especially for the people who've tried so many different other things, is just that, like you said, the connection, and also that belief that, listen, we know from the chronic pain research that as long as we judiciously give the right kinds of exercise intensity and use the right hands-on approach, there's a pretty good chance that you're going to improve. It's just going to take some time. But especially in the light of a lot of our chronic pain sufferers who don't have a quote unquote diagnosed injury to an area that's painful. But like you said, that mindset's so key. And I feel like sometimes I'm part psychologist in a way, even though I'm not a psychologist, but being able to connect with people on that emotional level to help them understand that, listen, if we do this and we're careful about it, there's a very high likelihood that you will get better over time. And that in itself can be the therapy, if you will, the physical therapy there too.
Yeah, absolutely. Yeah.
Do you find that in your field, Dr. Marianna, that more allopathic trained or Western trained physicians are seeing the light and they're also embracing more of the integrative complementary approach to medicine?
Yes. Yes. I see that more and more physicians are interested, at least in being open-minded about their therapists. Yeah. And I think that stems from patients' dissatisfaction.
Sure.
With patients' dissatisfaction with, how things are done to this point. And and their interest and necessity to have the physicians be open-minded.
Exactly.
I wish it happened more often.
Absolutely. Here's a question. As far as maybe a supplement strategy to help people who do have these chronic kinds of pain, are there a couple things that you might recommend as far as like, hey, from what I've experienced, if you use, I've heard like boswellia can be good too for these kinds of things. Anything that people might consider outside the box as far as supplements for pain?
Sure. I mean, it's a complex subject. I first would emphasize that pain is very inflammatory, and I think you've touched on that before, right? That diet is key, lifestyle is key, right? And anti-inflammatory diet definition is kind of broad. And I've learned to work with my patients and see how it can be tailored to their needs. So for those who might be listening and don't know what anti-inflammatory diet is, it's a diet that's focused in eliminating foods that are pro-inflammatory, so gluten, dairy, soy and corn and processed foods and sugar, and focusing on anti-inflammatory good foods, so to speak, right? Or foods that are rich in omega-3s, lots of fruits and vegetables, desirably free of pesticides, hence organic, lean protein, whole grains. But then I don't believe that everybody needs to be off gluten, and I don't believe that everybody needs to avoid animal protein. It really depends on the person and individual. And so coming back to pain, I probably would, with each individual, would see what the culprit is. And I often joke with my patients, tell me what your favorite food is, and I'll tell you what hurts.
Oh, I like that.
Yeah, I'll tell you what your problem is.
Oh, interesting.
Yeah.
So what are some of those things that you've seen that people have told you their favorite foods are, and they present with a certain condition?
Well, take the reflux, for instance, right? Tomato sauce.
Tomatoes, huge,
Spicy foods, right?
My favorites right there.
I love spicy foods. I love spicy food. Yeah. So anxiety, sugar, right? It's sugar, gluten, right? It's gluten, or let's just move the gluten away. Sugar, simple carbs, right? They're going to split in your body, become the sugar, give you the high, and then give a low, and then up and down. It's just a yo-yo.
So.
Yeah. As far as the supplements, I'd say magnesium in higher doses and turmeric, the very anti-inflammatory.
Mm-hmm.
Yeah, I love acupuncture for pain as well.
Oh, yeah, for sure. Yeah.
Yeah.
Do you think, I've heard that curcumin actually is a little more concentrated than turmeric itself. Is that
Right.
something you would also recommend?
That's what I'm learning now.
Yeah.
Yeah.
That's very cool. As far as like how physical therapy complements integrative medicine, it seems like there's a lot of parallel there. And you've had some experiences too from your own youth. How do you think they complement each other?
Sure. I mean, that's a great question. I refer a lot of my patients for physical therapy,
Mm-hmm.
even if they don't expect it.
Yes.
I don't know if you've heard about this book. It's called Body Keeps the Score.
That sounds familiar. I haven't read it yet, though.
I haven't read it yet either. Yeah, there's a big pile
Yes, of books.
at home. But on a broader spectrum, I do believe that our body stores a lot of trauma.
I agree.
Not only physical, but also emotional,
yeah.
psychological. Some trauma we may not even realize
Mm-hmm.
that is not available to us.
Mhm.
And so I really believe that some things not needed must be worked out through the body.
Yeah.
Yeah.
Got
So
it.
through releasing the tensions, the traumas. And so I think in an integrative sense, physical therapy in the right hands
Mhm.
can be incredibly helpful.
Yeah.
And then in terms of more of the musculoskeletal level, a lot of us use our bodies every day
Yeah.
without giving back, right?
Yes.
And over time, this wear and tear just becomes a chronic issue.
Absolutely. Yeah.
So I try to do everything to prevent my patients, unless they really want that, to prevent them from going on the surgical table.
Yeah.
Yeah.
We're the same way. We definitely, and it's funny, as more and more research comes out on different kinds of surgery that have been very typical in the orthopedic world, for example, meniscus and even ACL tears, they're finding that for these longitudinal studies that these surgeries are actually not even really going to help you in the long run. So are they even necessary? It has been the question. And thankfully, over the last 20 years, we've been able to successfully help a lot of patients avoid surgery over time, or at least get them into a state physically that they're going to have a really good outcome because they've done a lot of the hard work and developed the muscle and range of motion and other movement patterns that were beneficial before the surgery so that we can accelerate the recovery afterwards.
Yeah, that's
Yeah.
fantastic.
Yeah.
Yeah.
Cool. Dr. Marianna, how would people find you or get into contact with you if they want to explore the realm of integrative medicine?
No, of course.
Yeah.
So at the present moment, I practice at Summit Health,
Mhm.
and I am going to start my blog.
You
Look out
are?
for that.
Oh my God.
Just look for
Excited.
Marianna Shimelfarb.
Yeah, that's awesome. We'll have it in the show notes. Great. Dr. Marianna, thank you so much for coming on our show. We're really glad to have you.
Thank you very
and-
much for having me.
Oh,
It
you're
was
welcome.
a pleasure.
Great.
Yeah.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.